Hello everyone. So we are going to start with the INICET May 2025 recall series, and I hope so that everyone are enthusiastic after your INICET exam, because psychiatry, all the 7 questions are little bit confusing but easy to attempt the questions. So today we are going to discuss about all the recall questions. Totally we had 7 questions, and all the 7 questions majorly concentrated on the mood disorders as well as the mental status examination and core basics. So we are going to start with the first question. A 40-year-old woman with bipolar disorder is planning for pregnancy. Which of the following drugs must be avoided due to the possibility of neural tube defect? So there are 4 options that are given. One is valproate, oxcarbamazepine, lamotrigine and levetiracetam. What is your answer? Put in the chat box. Yes. So the answer is valproate. Why do we tell it as valproate? Because valproate has the highest risk of neural tube defect. I have covered the same in the dopamine search sessions also. Neural tube defect, valproate is a sure shot question in any entrance exam. Apart from that, oxcarbamazepine, they have given us a choice. It has a low risk, but again you need to have a caution because that can also cause. Lamotrigine is considered to be a safest drug during pregnancy, and finally levetiracetam, it is relatively safer in pregnancy. Very important thing is the side effects of valproate, which everyone has to know, because variety of questions asked in the recent years from the valproate side effect. Number 1, valproate is going to be having a liver failure, and valproate can cause hyperammonemia. So what you have to do is always check at least weekly once for the patient who is under IP care, who is being given with valproate. Check for the ammonia level to make sure that the patient is not going to have any other problem because of hyperammonemia. Same way, platelet count will be reduced. That is an important side effect. Tremors, pancreatitis are also important, and the reason why we avoid giving valproate in a pregnancy patient is because the child may get neural tube defect. If carbamazepine and valproate are given together, then there is high chances for a liver failure, and this is already asked in your INICET exams. Next, coming back to the oxcarbamazepine, it is first of all not used as a first line drug, and oxcarbamazepine most common side effect is hyponatremia. Moving towards the next question, which of the following are used in the management of acute mania? There are 4 drugs given to you. Out of these 4, remember, lithium, valproate, haloperidol. All the 3 are actually used as a first line management of acute management of mania, whereas amitriptyline is not used. Okay, so now let's see why it is not used and why all these are used. This is again a table taken from my own dopamine search class, where I have discussed about the treatments of acute mania. First thing which you have to understand is no single drug is present for the treatment of mania. Second thing is, whenever a patient comes with an acute manic episode with a previous history of depression, with a history of bipolar disorder, first thing you are going to do is stop antidepressants. Stop antidepressants. Second thing is, you have to classify them into 2 categories. One, if the patient is already in anti-maniac medications, or the patient is freshly going to take anti-maniac medication. If the patient is already taking anti-maniac medication, or if the patient is already diagnosed with bipolar disorder, then what you are going to do is, you are going to increase the dose of lithium and valproate and consider adding antipsychotic, considering that the current episode of mania is going to be there with the acute behavioral issues. So you are going to add haloperidol or any other antipsychotic for controlling it, and otherwise also you are going to also add a short-term benzodiazepines to control the current episode, current agitation of the patient. If the patient is not under any anti-maniac medication, then you are going to consider antipsychotics to control the severe behavioral disturbances as a first option. Then you are going to consider a valproate. But remember guys, as I already told you in the previous thing, number 1, you need to see whether the patient's LFT is alright. Only then you can give valproate. Second thing, you need to avoid valproate for a pregnancy patient, or even in a patient who is going to be under reproductive age group, and also consider lithium if future adherence is likely. Okay, and then again you are going to add a short-term benzodiazepine for all the patients. So this is the treatment protocol for a acute mania. Coming to the third question, This question is like most discussed in numerous platforms which I have seen yesterday. So the question says, a patient with schizophrenia says that Lord Hanuman is a celibate. I am a celibate too, and so I am a Lord Hanuman. Most of you confused with the term celibate, which actually has a meaning. It is not a new word, or it is not a word used in liaise with the celebrity. It is a celibate. It is a word with a meaning. So you can't tell this as a neologism. It is not a new word. So which thought abnormality is present in the patient? It is not neologism. Second thing, you have given an option with loosening of association. Many people got confused why it can't be loosening of association. The reason is Lord Hanuman is a celibate, one sentence. I am celibate too, another sentence. So I am Lord Hanuman. All the three sentences are linked with each other. If there is a linking of sentences with each other, then you cannot call it as a loosening of association. So the first option, C option, is also gone, and loosening of association, D option, is also gone. Now the people are confused between A and B. A tells you artistic thinking. B tells you verbigration. Verbigration means exaggeration. Here there is no exaggeration. The patient is having a schizophrenia. Patient is having a new ideology or new thinking. Let it be logical or illogical. The patient is going to have thinking. New ideas are popping up inside him. So this is not verbigration. So either by ruling out the options, you can identify it as artistic thinking, or I can otherwise identify it as the answer by easily. So then the option can be easily understood by the terminology called as artistic thinking. What is artistic thinking? The patient is using idiosyncratic, illogical words or delusional beliefs. That is classically artistic thinking. Often this is seen in schizophrenia. So the option A is the right answer. Option B, option C, option D, you need to understand why it is not the right answer, as I suggested now. Next, coming towards the fourth question. Which of the following statement is incorrect? Again, there is a lot of confusion with this question. So I thought of like going into journals and the papers, and I found the answer. I'll share with you guys. The option A tells that alcohol in low doses causes brain stimulation. Higher doses causes brain suppression. This is the first option given. Second option, cannabis use can result in self-driven repetitive behavior. That is absolutely right. It is not a wrong answer. Opioid are very effective analgesic. That is also right. Now the confusion lies between option A and option D. Option D tells volatile inhalation agents are mostly toxic to humans. They are telling mostly toxic to humans. And option A is telling alcohol in low dose causes brain stimulation and higher doses causes brain suppression. Now you are confused between option A and option D. Now I will tell you, just put in the chat box whether it is option A or option D. Yes, most of you think that option A, because alcohol is always a brain suppressant, and how can I tell that alcohol in a low dose causes brain stimulation? This would be your argument. And option D, volatile inhalation agents are toxic to humans, but they are given that mostly toxic. See, everything we cannot generalize as mostly toxic. So my option, if you ask me, I will tell that option A is right and option D is wrong. So the answer for this question is option D. So remember, volatile inhalation agent is widely used even as anesthetic agent. So how can you tell mostly toxic? So the option D is wrong. Now coming to option A. Sir, most of the time alcohol causes CNS depression. This is a statement given in majority of books. Then how can I tell that low dose causes alcohol stimulation? Alcohol is going to cause stimulation, and at higher dose it causes suppression. How it will be correct? See, remember, so according to the textbooks as well as the research paper, it clearly tells that low dose of alcohol is going to stimulate, whereas the higher doses will cause CNS depression. So according to the well-documented medical literatures, the option A is actually right. So you cannot call it as an incorrect one. Same way, why option D is incorrect? Because volatile inhalation agent is not mostly toxic. Some of them we use as anesthetic, and only certain abused inhalants like butane, nitrate, toluene, all these are only toxic. So mostly that one term made this question as not correct. Now Okay, so clear, right? Now coming to the question number 6. Which of the following is not a ICD-10 diagnostic criterion for depression? Remember, this also I actually covered in the dopamine search. So remember, there are few important criteria that is needed to diagnose it as depression. So I would have given a mnemonic siege caps. So you can go back and you can refer it. So to be very particularly, so depression, when you're going to tell, so you should have few important criteria. Point number 1, the patient must have low energy. Point number 2, there should be reduced sleep. Point number 3, patient must have reduced appetite. And very important thing is, the patient must have a reduced interest in previously pleasurable activities. There has to be low self-esteem. There has to be low confidence. But remember, okay, what I wanted to tell you is, low self-esteem and low confidence is not a diagnostic criteria. Because of low mood, there can be low self-esteem and there can be low confidence, but low self-esteem and low confidence need not be the diagnostic criteria. Diagnostic criterion, when I have to tell, the patient has to have low mood, the patient has to have low appetite, the patient has to have reduced energy, the patient must have reduced sleep, the patient must have anhedonia. Out of again all these 5 criteria, when you're going to ask me low mood, reduced energy, anhedonia, all the 3 are the definite diagnostic criteria that you need to understand. Now coming to the last and final question, which of the following is a new psychoactive agent resulting in rapid onset of action in the management of depression? Remember guys, this is again based on the research and recent updates they have asked you. So if at all you cannot identify which drug it is, you can actually rule out and see. That would have been a much better option. But anyway, I'll tell you how do you rule out. Number 1, they have given cannabinoids. Remember, cannabinoids is not used officially for depression, number 1. And they are not approved also. So ultimately, option A is ruled out. Option B, they have given ketamine. We don't know about it, just we will leave it. Option C, bupropion. Bupropion is a atypical antidepressant and they have clearly mentioned that rapid onset. Remember, bupropion is not a one which is going to have rapid action. It takes minimum 2 to 4 weeks for effective action. So bupropion is ruled out. Finally, mephedron is given. It is again having a no therapeutic role in depression. So you can rule out option A, option C, option D. Finally, you have option D. So in that way, at least you could have answered. In the other one, ketamine is a NMDA receptor antagonist that has a rapid onset of action and they are acting as an antidepressant, which is effectively seen just in 6 hours, especially in a treatment-resistant depression. It is used in a low-dose IV or intranasal form, and this question actually is based on this research paper where they have clearly mentioned based on the question, which of the following is a new psychoactive agent resulting in rapid onset of action in the management of depression. So the answer for this question is ketamine. So totally 7 questions came in the exam, and out of the 7 questions, it is going to fetch you 28 marks. That is actually going to elevate your rank by 10,000. So all this 7 actually is covered by me in the dopamine search discussion, which is available in our app. So I request you all to go to that video and actually see the entire 1.5 to 2 hours of class where I have covered all these 7 questions, and this was prepared just even before the INICET. So just imagine, this is going to give you a very important boost in your NEET PG exam. So what I will tell you is, go through the dopamine search video where I have covered rapidly all the topics of psychiatry. So if you have further doubts or anything, you can actually ping us in the dopamine page or in the Instagram. We will be ready to help you out. So thank you once again. So I wish you all a fantastic exam preparation journey for your NEET PG 2025. All these topics are very important topic, nothing new, but it is going to be a very important basics. So I request you all to cover the basics, then move towards others, because nowadays basics are the one that is asked in your exam. So I wish you all the best. Let's see you all in a fantastic session in the next time. Thank you.